Good day, everyone, nurses and students. My name is Dr. Eustaquio, and I'm the hospital manager of our local community hospital. I conducted this meeting to have a brief discussion about our skeletal system and more about that. And together, we have a special guest for today, the doctors, respected doctors of our local community hospital, Dr. Ramos and Dr. Lepalam, are orthopedists. So they will help you to have some idea concerning about the treatment of bones, as well as the muscle, joints, nerves, ligaments, and tendons. But for now, we will talk about the possible traumas you can get with your bones. Now we will start with our Dr. Ramos and Dr. Lepalam.
So, good morning, nurses and students. My name is Dr. James Aaron Ramos, and you can call me Dr. or Sir Ramos.
Hello guys, I am Dr. Camila Palam and you can call me Dr. or Ma'am Camille for short. We are here to give you an idea on the different types of fractures and ways on how to take care of them.
So as the doctors introduces themselves, let's start our conference. Please take away the floor, Dr. Ramos and Dr. Lepalam.
Thank you, Dr. Estacio. Nurses and students, today we will be discussing about the fracture. Dr. Ramos, can you explain what is fracture?
Good morning, nurses and students. Basically, a fracture usually results from a traumatic injury or event to the bones, causing the continuity of bone tissues or bony cartilage to be disrupted or broken. So, we have different types or classifications of fracture, which are simple, compound, incomplete, and complete. So may I ask, do anyone here know what is simple, compound, complete, and incomplete fracture?
I have an idea, doctor. Simple fractures, more recently called closed, are not obvious as the skin has not been ruptured and remains intact, while compound fractures, now commonly called open, break the skin, exposing bone and causing additional soft tissue injury and possible infection.
I also have an idea, doctor. Fractures are termed complete if the break is completely through the bone and described as incomplete or green stick if the fracture occurs partly across a bone shaft. This latter type of fracture is often the result of bending or crushing forces applied to a bone.
That's nice. Your answer are correct. There are types of fracture lines. Those are identification of a fracture line can further classify fractures. So types include linear, oblique, transverse, longitudinal, and spiral fractures. Fractures can be further subdivided by the positions of bony fragments and are described as comminuted, non-displaced, impacted, overriding, angulated, displaced, avulsed, and segmental. So additionally, an injury may be classified as a fracture dislocation when a fracture involves the bony structure of any joint with associated dislocation of the same joint.
Very well said. Now, we will give you our patient's past records and you will identify what class of fracture, find its anatomical position, the type of fracture line, and how will you treat them. Now, I need you to divide yourself into two groups.
As you have given enough time to have a meeting about your presentation, now let's start with the group 1 and followed by the group 2. So let's start your presentation.
The figure presented shows a complete fracture in a transverse line in the right antebrachium or right forearm of a 34-year-old male. A complete fracture is a fracture in which the fractured bones are completely separated from each other. This fracture, as I've stated, is a transverse or straight across the bone complete fracture. The fractured bone is the radius and the ulna of the anterior and posterior right antebrachium or right forearm of the body.
There are different treatments and surgeries needed for various types of bone fractures depending on the severity. Some complicated fractures may need surgery and surgical traction. The treatment needed for this type of fracture is includes embolizing the bone with a plaster cast or surgically inserting metal rods or plates to hold the bone pieces together. In most cases, your cast will be removed after a few weeks, but you must treat your limb with care for at least the next month or so.
Good day, everyone. My name is Sunny Dolorosa, and my co-speaker is Miss Clarissa Dilumin, and we will talk about the right leg. We will focusing to the anatomical position, right femur, complete fracture and segmented fracture, and treatment or surgery. But now, let's call on Miss Clarissa Dilumen to tackle about the anatomical position of right leg.
Okay, thank you, Mr. De La Rosa. So, in this presentation, you can see the anatomical position and the anterior and posterior view of femur. And today, we are going to tackle about the right femur. But now, first, what is femur? Your thigh bone femur is the longest and strongest bone in your body. Because the femur is so strong, it usually takes a lot of force to break it. Motor vehicle collisions, for example, are the number one cause of femur fractures. The long bone straight part of the femur is called the femoral shaft. When there is a break anywhere along this length of bone, it is called the femoral shaft fracture. This type of broken leg almost always requires surgery to heal. So, complete fractures. In this type of fracture, the bone has broken into three or more pieces. In most cases, the number of bone fragments corresponds with the amount of force that needed to break the bone. Partial fractures are the break doesn't go all the way through the bone. Second is segmental fracture. It is a fracture composed of at least two fracture lines that together isolate a segment of bone, usually a portion of the diaphysis of a long bone. This fracture pattern is frequently associated with high energy mechanism and devascularization of the segment fracture fragments, meaning these injuries are associated with increased morbidity and long-term complications such as delayed union, non-union, and or infection. So, last is immobilization. Restricting the movement of a broken bone in your leg is critical to proper healing. To do this, you may need a splint or a cast, and you may need to use crutches or a cane to keep weight of the affected leg for 6 to 8 weeks or no longer. So now may ako on Mr. De La Rosa to continue the topic.
The timing of surgery. Most femur fractures are fixed within 24 to 48 hours. On occasion, fixation will be delayed until other life-threatening injuries or unstable medical conditions are stabilized. To reduce the risk of infection, open fractures are treated with antibiotics as soon as you arrive at the hospital. The open wound, tissues, and bone will be cleaned during surgery. For the time between initial emergency care and their surgery, your doctor may place your leg either in a long leg splint or in traction. This is to keep your broken bones as aligned as possible and to maintain the length of your leg. Skeletal traction is a pulley system of weights and counterweights that hold the broken pieces of bone together. It keeps your leg straight and often helps you to relieve pain. And that's all. Thank you very much. Thank you for listening. God bless us.
It's really well presented, and you even presented some other ideas.
I would like to agree with that, Dr. Camille.
I guess, shall we end this meet? Is there any questions, everyone?
None po, Doc.
So I think that's the end of this session. Once again, I am Dr. Ramos and I'm with Dr. Lepalam. I hope you learned a lot from this session. Goodbye, everyone.
Goodbye po and thank you.
Did you learn a lot, guys? So, well, I've seen you presented the fractures very well. There's still a lot of things to learn about our skeletal system and doesn't just end with this session. So, I hope we could meet again next time. And I do hope you enjoy today's session. Have a good day and stay safe, everyone. See you again next time. A fracture is a broken bone. It's a term to be described in the break in the community of the bone. It can range from a thin crack to a complete break. Bone can fracture crosswise, lengthwise, or in several places, or even into many pieces. Most fractures happen when a bone is impacted by more force or pressure that it can support. Lack of calcium or even vitamin D, the lack of that makes them weak and prone to bone fractures. So if you suspect you have a fracture or anyone who says some symptoms about bone fracture, seek medical help immediately. Once again, I'm the leader of this group, Rachel Eustaquio, with my members. Thank you for watching.